Hello, everyone. Welcome to my show. Autumn is here. I'm your host, Francine Crawford. And today we have Dr. Meghan Kelly, and she's an orthopedic surgeon. And she's going to give us some information on about caring for our parents and things to look out for. Welcome to the show.
Well, thank you very much, Francine. Like she mentioned, my name is Dr. Meghan Kelly. I'm an orthopedic surgeon by training, but my specialty is in foot and ankle surgery. But I also take care of patients, all over. So I help with hip fractures and things like that, where we see, which unfortunately we do see in the older community. So yeah, I'm happy to be here. Thanks, Francine.
Okay, well, that's good. That's interesting to know because I didn't know that. So that's interesting. How long have you been practicing?
So I've been in practice as my job as an assistant professor I'm in the end of my third year. Prior to that, the process of becoming an orthopedic surgeon is unfortunately a little bit of a long one, and I took a very circuitous route. So I went to college and then I went to grad school. I did some research for a couple years, got a PhD in physiology, and then decided I wanted to go back to med school because I wanted to work with people. So I went to med school. I did 6 years of residency. It's 5 years of clinical work and 1 year of research, and then did a 1 year foot fellowship out on the West Coast, and then came back to New York for my practice. So it's always an interesting transition, as transitions are. But it's been a great experience so far, and I've been, very happy. My patients are wonderful.
Okay. How important would you say it is, especially as you're aging, to look at your feet, examine your feet? How important is that?
So I think it's actually very important. A lot of changes occur, throughout our life, and as we get a little bit older, it's very difficult to have painful feet, whether it's due to arthritis or tendonitis, things like plantar fasciitis, all the itises that I'm names that I'm throwing around, but they can make it very disabling to get around. And especially if you have a history of diabetes, that's a big thing as far as checking your feet go. One of the things that tends to go along with diabetes, unfortunately, is what's called neuropathy. And that is when the little nerve endings in your feet, and in your fingers too, but more noticeable in your feet, they can get damaged. And it makes it so you have what's called the loss of protective sensation. All that means is it really just means that if you were to step on something, you wouldn't feel it. And the concern with that is obviously if you step on something soft, it's not a big deal. But if you step on a splinter, you step on, a piece of glass, what that can do is that can cause a wound on the bottom of your foot. And if you can't feel that wound, it can get deeper and deeper, and ultimately get infected. Neuropathy, unfortunately, even if you're a very well-controlled diabetic, can happen in folks anyway. Neuropathy can also happen in patients without diabetes. I see a lot of folks where they have some numbness and tingling in the tips of their toes. And that tends to be the start of neuropathy. Unfortunately, we don't have great things to treat it right now. But some of the things that can occur with neuropathy, other than just losing the sensation in the bottom of your feet, and making you, have to check your feet for wounds and check for sores and things like that, is a couple things happen. One, because your sensation is a little bit off, folks tend to buy shoes that are a little too small for them, because they don't realize they're tight, because they don't sense the pain. And the shoe can rub and cause wounds on the side of the feet or on the front, on the top of it, just because you're just wearing a size that's too small. Mm-hmm. The other thing that can happen with neuropathy is you just don't have a great sense of balance because you don't have a good sense of where your feet are in space. So you feel a little off kilter. So that can lead to other issues. As you can imagine, it can lead to falls. It just can lead to a sense of instability when you're walking.
Okay, so if you were taking care of someone, that's something that you would look at, like if their shoes were too small. So that's something that you should check out, your parents' shoes or things like that. Okay,
exactly,
and their balance,
and see how the shoes fit. I mean, if it's really hard, there's the shoes that are a little hard to get on but are still fitting appropriately, and then there's shoes that are just too tight. So getting a sense of where the wounds are, or where things rub. If it's rubbing on like the outside and the inside of the foot, that might be a shoe issue more so than, having it damaged from something else. Watching folks walk is really important. If they tend to sway side to side, as a lot of people do, that's making sure that they have good grips on their shoe wear, or even slippers with, you want slippers with like grippies, and some kind of friction on the bottom, just so that you can, especially if you need something to help you walk, whether it's a walker or a cane, you want to make sure that that's not going to cause you to fall.
Okay. So is that what leads to when people have diabetes and then they lose toes and things like that? Is that part of that? That's what happens?
It can be, yeah. It often will start with, and losing toes is tough. I've seen it happen. I've had to do it on patients. It's not fun. And unfortunately, sometimes it happens in patients where their diabetes is actually very well controlled. It's just bad luck. If they have less of a chance of it happening, and it may happen much later in life than someone who's very uncontrolled. I will say most of the patients that I've seen where they're having trouble in their toes in their 30s and 40s, they tend to be those that are generally pretty uncontrolled. But keeping sugars under control is one of the best things you can do for it. Also, if there's a concern for your blood circulation, seeing a vascular doctor, which is someone who kind of controls your blood, helps control your blood vessels, and make sure that you have good blood flow to the fingers and toes. That's also something that, if that isn't working, can cause wounds on the toes and cause them to not heal, which can lead to amputations.
Okay. So I'm curious about when people are in a nursing home, because many times when people are in a nursing home, and I've experienced this with my mom and with other relatives, I don't care what they go in for, but they always end up, in the end, they have a sore on their foot or something like that, and it doesn't heal, and they pass away. So like, what? Now, if they're diabetic, I understand that could possibly be it. But you said also if they're not diabetic, what is happening? First of all, tell us what is happening that they get these sores.
So often, and the trouble with nursing homes is usually if somebody is in a nursing home, they aren't able to move around as much as someone who isn't in a nursing home, and they need help anytime they shift their body weight and things like that. And what happens is when you're in the same position for long periods of time, the skin can get damaged. And that's why a lot of times you'll see folks come in and they just kind of, because I saw this with my grandfather when he was in a nursing home as well. They come in and they kind of shift you to one side, and then they come back a couple hours later and shift you to the other side. And they kind of do that because, unfortunately, gravity being what it is, fluid and tends to collect with gravity, and it tends to collect under our bottom. And that tends to be the place where the skin is a little fragile right on your lower back as it kind of hits the top of your butt. And that's an area that people do pay attention to, because if there's a lot of pressure on that area and they can't feel it, too well. And it's the same thing in the foot. If they have their foot resting on even if it's on something that is a little firm and kind of pushing back on the heel, the heels just the skin gets I don't even know how to, it almost gets like blistered. And then over time, if it's not taken care of quick enough, it can just progress where it just gets deeper and deeper where it finally hits bone. This obviously tends to happen a little bit more in the bottom area where they're a little more cautious of it. Mm-hmm. But it can happen in the feet, and I've seen it happen in the heels. Mm-hmm. I actually had a hip fracture patient who saw me. He was doing great in his hip. The problem was he had developed really bad heel ulcers. Yeah. So the best thing to prevent that is to actually let the feet, the heels suspend in air. So what that means is, sometimes some of the nursing homes will have special shoe or special, it's not really a shoe because it's very soft. Yeah. Huh? Yeah. Like it's like those little booties, like they're really soft. It looks like lambs, like a full lamb wool on the inside to help cushion the heels. Okay. But if they don't have that on, or if they can't wear that for whatever reason, putting a pillow underneath the calf muscle so that the foot is kind of extended off the edge. So say this is the calf muscle here, and have the foot kind of hanging off the edge. That's another thing that can help prevent it, because it's really they're pressure sores, and they're named that because they get that way because something is putting pressure on it for long periods of time.
Oh, okay. Okay. So that's a good idea, because I was going to ask you, what can we do? Because it seems like it always happens. And I'm trying to figure out, is there something that the caregiver or family member can ask them to do, or provide for them, or is something for them to do if they're at home to make sure that they are, moving? I know they have to move around, but to actually get those footies or something like that, can they request it? Can they?
Yeah, they can request. I think they're called Prafos, Prafo. What that is it's basically a very soft booty that has a lot of like cushioning on the inside to just help elevate. And it's very cushioned, and it feels almost like it's blown up, because you want something very light. That's why they also have like a lot of the places will have like the air support mattresses, because a mattress, as you can imagine, is also can develop pressure areas where you're lying down, but the air ones have less pressure on it. So theoretically, it's supposed to decrease that risk. But if they don't have Prafos in that facility, or if you're at home and aren't able to, have them, one thing that you can do is again support the calf muscle, because muscle doesn't tend to develop sores. Areas that are very muscular don't tend to develop sores because the muscle is there. Okay. It's the areas that have very thin. It's basically just skin and bone. So that's why the heels are very common. And that area, like right in your lower back, because you don't really have a lot of muscle on right in the center of your back because your spine's there. But that's when the pressure is basically, it's just skin and bone. So if you put cushioning underneath the calf muscle, it raises the heels up. So they're actually just floating in the air, and they have nothing to push on them.
Oh, okay. Okay. So that's something good that they can do at home, that they can do.
Yeah.
Okay. Yep. Okay. So would you suggest that, is there any kind of exercise or anything that they can do?
So exercises to do, things that it's always a little, different on, depending on the patient, but, to prevent like blood clots, and to prevent, the ankles from getting stiff, at least, just doing like gentle ankle circles a few times a day can be really helpful. Just moving the ankle, just kind of like this, just around and around, 2-3 times a day, that can keep it from getting stiff. Another thing that can develop in people that are stuck in bed for long periods of time is they can develop what's called an equinus contracture or an Achilles contracture. And what happens is the natural balance of our tendons in the ankle, the Achilles is very tight. So for people that aren't able to walk or walk for very long periods of time, what happens is their toes start to point over time and you can't straighten them up. So, naturally our bodies overcome that because we walk, we stand on our feet, and that kind of allows us to bend the ankle. But people that can't, whether it's due to a stroke or just due to deconditioning, they can develop these contractures. And sometimes they can get bad enough where if they do try to walk, they can only walk on their tippy toes, which of course is not great for balance either.
Right.
So that's why, making sure that, loved ones, especially in nursing homes, that people are working with their feet and ankles, making sure that they're having, if they can't move their ankles back and forth, that someone is moving them for them just to help prevent the contractures from occurring. And that can be helpful, especially in the rehabilitation process.
Okay. Thank you. That's good because we want to be able to help our loved ones, whether they're in a nursing home or whether they're at home, and before something happens, before they get, any marks on their foot or things like that. So
exactly.
Is there anything that you know about that people should know that maybe you see that's frequently that happens with the foot, or that happens, in your practice that people should know about and to, give them some information on?
I think one big thing is, keeping an eye on environment. It's a little bit less so in like a nursing home setting, but more if you're taking care of family members at home. Keeping an eye out on like their home environment and see if there are things like tripping hazards. So if you see where there's areas where there's uneven ground, or if you have a very slippery rug, definitely slippery rugs are no fun. Hip fractures are even less fun. So things that could potentially be a tripping hazard can be important to get rid of those just for general safety. Having lights, and especially if you can get those, I think they have them on, probably, I'm sure they have them on, you can buy them on Amazon or anywhere else, like little motion lights on the floor. Okay. That can be, I think my mom has them actually. She has them in the laundry room, but you can attach them. They have like a sticky bottom and they're motion sensing, so that for folks that get up in the middle of the night, have to use the bathroom, having a little light or something that will go on so that if there is something there, they're not going to trip and fall. Because that's when a lot of hip fractures occur, is it's people getting up in the middle of the night to use the bathroom and they trip over their cat or they trip over a shoe or something like that. So having a light, having a motion sensor light can be helpful on the floor. Also having good footwear in the house. I'm a big fan of slippers. I get it. I love slippers. But having slippers with a good firm bottom that's not going to slide is also helpful to prevent from the slip and falls from, not only because I see them with ankle fractures as well, but ankle fractures and hip fractures.
Okay. Well, thank you. Would you suggest closed-in slippers?
I would say I'm not anti open-toed shoes. It's more about the bottom.
It's more about the bottom.
Yeah,
okay.
It's more about the bottom.
Okay. All right. Well, thank you very much. I appreciate you giving us this information and coming on us here. It's a lot of helpful information that people don't realize until after the fact. And you wonder, what can you do? And this is good. So we'll know certain things that we can do before something happens, to one of our loved ones. So thank you for taking the time. I appreciate it. And hopefully we can help people from not tripping and falling and not getting the bed sores or sores on their foot, because I see that so often from nursing homes, and it's a concern. It's a concern.
Yeah.
So thank you again.
No problem. Thanks, Francine.
You're welcome. Good night.